and welcome to our Gold Learning viewers. I'm Fiona Lang-Sharp, IBCLC Public Relations Manager and MC for Gold Learning. Well, welcome everybody. I have the pleasure of sitting down with Melissa Cole today, who is going to be speaking at our upcoming symposium, Will It Hurt? Phrenotomy Aftercare Strategies to Optimize Healing Outcomes for the Newborn. Welcome back, Melissa. It's so good to have you here today.
Thank you. It's always fun.
Now, I feel like Melissa is part of our Gold family here, and she has presented for us before, I think more than one time, Melissa. That's correct, right?
Yes, it's always a pleasure.
Yeah, so it's great having you back here. But for some of our listening audience, it might be the first time they've heard you. So I would really love it if you could go ahead, introduce yourself once again, and tell us a little bit about why you would like to present on this topic.
Absolutely. Thank you. So I have a private lactation practice in Portland, Oregon, where it rains a lot, but it's also beautiful. And I have the pleasure and honor of working with many families and have a specialty in working with families pre and post phrenotomy. And that's really where my interest in the topic of pain and stress relief strategies post phrenotomy came from. I've worked with babies pre and post phrenotomy for more than a decade, and I've seen a range in how babies respond to the procedure, anywhere from sleeping through it to crying days on end afterwards, and this range of how babies cope is so varied. So that's where my interest in the topic came, was finding ways to really help babies heal optimally post-procedure.
It's so wonderful to hear more developments in this area for sure. And I know you have a real passion for the baby post care, as do I. I feel like for so long, a little bit like we were fumbling along and we didn't have very clear strategies. But of course, still in the early days, in terms of the actual practice of itself, getting a phrenectomy. So really important stuff. So excited that you've been working on this. I really appreciate it for sure.
Yeah.
So I have another question for you, and it's in terms of really the developments that have taken place in this field, and even in your practice, Melissa. Maybe you can share a little bit about, what has transpired and what has been of most interest to you in this field.
Absolutely. So looking at a field of pain assessment and management, and then also looking at phrenotomy, we have a lot of building evidence and research around the benefit of phrenotomy. We know it helps. Everyone wants to know, well, where's the research and the evidence around the aftercare? It doesn't exist yet. There's really nothing published. So we're building that body of evidence. And as researchers know, it's very hard to ethically do, randomized controlled trial for something like aftercare in infants. However, we can really extrapolate information from other fields in terms of pain management, infant state regulation, whatnot, and apply it to the babies that we work with post-phrenotomy. A couple of the interesting developments recently have been in changing or shifting what we thought we knew about things such as Tylenol, acetaminophen, or oral sucrose. We used to think of them in one way, and now we're having to rethink through them, and then thinking about things that are supposedly simple, like skin-to-skin and breastfeeding, and realizing actually how powerful those pain relief modalities are.
Wow, that just blows my mind. Just hearing those things, I'm nodding with you and I'm, hearing what you're saying, and it is so true. We've really have changed so many of the things that we used to do, and the developments that we have, changed in our practices, the things that we've learned. I think just even the well-being and the mental health and care of the mother and baby together post phrenotomy have really transpired. So I, again, can't say thank you enough in the fact that we're really looking at these strategies for healing and pain, because that's something that has really been minimized in babies for so long, I feel.
Yeah,
We haven't really addressed it. But like you said, it's hard to ethically do these types of things and get the research.
absolutely.
So I do appreciate the fact that you're looking at the other side of the research as well. So it's going to be great. I can't wait. So
Thank you.
lastly, and before we give any more away, because I'm just getting so excited about all of this, perhaps you can just share a little bit about what you hope the delegates will take away from this presentation.
Absolutely. I always want people to take away practical ideas that they can actually apply rather than just theory. So I want delegates to be able to have practical phrenotomy aftercare strategies that can help reduce pain and stress in the newborns they work with.
Perfect. Well, that's great. Thank you so much. I appreciate that. There's nothing like being able to take something we learn and put it right into
Yes,
practice
I
immediately,
agree.
because we're all hungry to get the
Yes,
information, right?
always.
Always hungry
Absolutely.
to get that. That's fantastic. Well, thank you so much, Melissa Cole. And again, Melissa will be speaking at our upcoming tongue tie symposium, and her title of her presentation is Will It Hurt? Phrenotomy Aftercare Strategies to Optimize Healing Outcomes for the Newborn. Thank you so much for sitting down with me here today, Melissa. It's been great having you again.
Thank you very much for having me here.
And thanks to our listening audience for being here. We look forward to having you again. Bye bye for now.